Hi, I'm Dr. Bhargav Rao from Pathofast Lab in Pune. Patients often ask us what is a good level of the prolactin blood test or the prolactin hormone to get pregnant. Patients and you might not be aware of the fact that prolactin can cause significant problems with your pregnancy, and so it's important to know what's a good level. Now, what is prolactin? Prolactin is a hormone which is secreted from a gland, or it's released from a tiny little gland in your brain, which is called the pituitary gland. And the only function of the prolactin is to actually cause the milk production and secretion at the time of breastfeeding, which is something that happens after pregnancy for the infant. So the only real purpose is to release the milk from the breast. There's no other real use of this hormone, and its only use is in women. It is also has some importance in maintaining good mood and also libido. Now, this is the only function, but what is important is that if you are not pregnant and your prolactin level goes higher than normal, it will affect your chances of getting pregnant, and I'm going to come to that in the next slide. So in non-pregnant women, a normal level of prolactin is somewhere between 3 to 25. Now this is a level which, if the value goes higher than this, begins to have certain effects on your body. These include irregular cycles. You may not have your cycle at all. It may cause what we call amenorrhea, which is no cycles. It may which is no bleeding, or that means no cycles. It may also cause you to have anovulatory cycles, which is when you don't release an egg during the cycle. And all this obviously means that you're not going to be able to conceive properly because your cycles are disturbed. So a higher than normal prolactin level is a significant problem if you're planning to get pregnant, and you must make sure that the value is less than 23 for proper pregnancy and conception. So what are the reasons and what can you do if the value is higher than 23 or 25? Very often the increase in prolactin, if it is not more than 50, is usually just incidental, and if you test it on another occasion, it may even be normal. Secondly, there are a lot of medicines that are available to treat the causes of this elevated prolactin. I've included some of the causes in another video that I've made, but they're usually attributed to a growth inside your brain, actually a growth in the gland that makes this prolactin. That gland swells up and that causes the prolactin level to become higher than normal. Some medicines like antipsychotics can also cause a higher than normal amount of prolactin, so stopping that medication should solve your problem. Other than this, there are causes like infections, other endocrine abnormalities, all of which can play around with your prolactin level and can cause this infertility. So there are a lot of treatment options available. The level usually comes back to normal once you start the treatment, so you shouldn't panic. And that's all you need to know about this topic.